for joining us tonight for our first of 4 conversations here within the community during May Mental Health Month. I'm Jen Connect. I am a principal with the Stevens Point School District, and I have with me a panel of people who will introduce themselves in just a minute. So just for those viewing, you will not be able to unmute your mic, and we also cannot see your video. If you wish to ask questions or communicate with us, I'll be monitoring the chat throughout the presentation, and you can just make your comments or ask any questions in the chat. We'll be providing a lot of resources in the chat as well, links, and then we'll also share those resources with you after the presentation too. But at this time, I'm going to turn it over to Lisa Grassoff, who's going to be facilitating the discussion tonight. And like I said, if you have any questions or need anything, just pop it in the chat and we'll keep an eye on it.
Great. Thanks, Jen. Hello, I am Lisa Grassoff. I'm one of the coordinators of the Mental Health Navigation Program at CAP Services. Welcome to the first of 4 community conversations. These conversations are a collaborative effort between the Suicide Prevention and Mental Health Awareness Coalition, AODA Coalition, and Stevens Point Area Public School District in an effort to raise awareness, provide resources, and reduce stigma around mental health as it pertains to youth. The Suicide Prevention and Mental Health Awareness Coalition of Portage County consists of community members and representatives from local businesses and organizations. The coalition provides hope, creates awareness through education and events, and facilitates change in the community to support mental health, prevent suicide, and reduce mental health stigma. As many of you may already know, May is Mental Health Awareness Month. Mental Health Awareness Month has been celebrated in May in the United States since 1949. The purpose of Mental Health Awareness Month is to raise awareness of mental illness and stigma, provide education on methods to stay mentally well, draw attention to the prevalence of suicide, and spread a message to all those who have mental health challenges that they are not alone. Mental health has been at the forefront of conversations over the last year due to the significant needs uncovered by COVID. The impact reaches youth, parents, professionals, and communities. Before we get started, I'd like to allow the panel to introduce themselves. Please provide your name, profession, and title, and how you support mental health needs in the community. And we'll start with Aimee Pond.
Thanks, Lisa. So my name is Aimee Pond. I am the crisis intervention worker for Portage County Health and Human Services. And how I provide mental health treatments and services in the community is I am the main contact for the county for all Chapter 51 proceedings, which is the mental health court proceedings. I do community assessments for individuals that are in crisis, whether that be at their home, in the jail, at the hospital, or any other place, maybe the schools as well. So really getting individuals that are in crisis or having mental health concerns connected with area resources and services within Portage County.
Wonderful, thank you, Aimee. Now we'll move on to Aimee Burazin.
Thanks, Lisa. I am Aimee Burazin, school psychologist for the Stevens Point Area Public School District, specifically at Stevens Point Area Senior High School. My role is that of kind of direct student services support with students, but I also provide a great deal of consultation with administration, school counselors, teachers to identify and work to eliminate barriers students may be having in regards to finding success at school, a lot of times that being mental health related challenges. So thank you again for having me, Lisa.
Thank you, Aimee. And now we'll move on to Trina.
Hi, I'm Trina Bierman with the Mental Health Navigation Program at CAP Services. I also am a chair for the Suicide Prevention and Mental Health Awareness Coalition of Portage County. I am here this evening, though, also as a parent, as I have 2 students in the Stevens Point School District. The way I support mental health needs in the community in my professional role is that as a mental health navigation coordinator, we help Portage County residents find mental health resources as well as other community resources that support their mental health and well-being. We also provide short-term support until people feel good about their connections that they've made. And as a chair for the coalition, we really strive to educate the community, to reduce stigma, and support mental health awareness in our community.
Wonderful. Thank you, Trina. And now we're going to move on to Autumn.
Hi, I'm Autumn Arns. I'm a senior at SPASH right now. I kind of like experience, I can see how I help out in the community, I guess, with mental health and stuff is I can see kids that are struggling at school and help them get help. And then in the community, I also volunteered with NAMI a few times with the Walk for Hope and stuff like that.
Great. Thanks so much for being here, Autumn. We definitely appreciate it. Is Victoria here? All right. So then we'll move on to Michelle Nelson.
Hi, my name is Michelle Nelson. I am the social worker at St. Michael's Hospital Ascension, and I work on the mental health unit. And I am also co-chair of the Suicide Prevention and Mental Health Awareness Coalition here in Portage County. And I'm sorry, I've been having some problems with my computer, so I had to switch computers. Technology is a wonderful thing. So I kind of missed some of the first part. So was there something else that I was supposed to add to my introduction? I'm sorry.
No, you're fine. We had name, profession, title, and then how you support mental health needs in the community.
So I support mental health in the community in many different ways. Obviously, by helping people when they're inpatient, when they need acute care, but also in the community by doing various things like this. But I also go out in the community by doing various presentations with suicide prevention and just helping to educate people as a whole with mental health by helping to break the stigma with mental health and providing mental health awareness and such.
Wonderful. Thank you, Michelle. So before we move on to some of the questions, what I really want people to know about is that we have put together a lot of wonderful resources that you could access. Jen's going to drop those in the chat. And then we also have some May Mental Health Awareness Month activities. And Jen can put that up on the screen so that you can all see. These are some of the things that we have going on. You'll find green ribbons around the community. We've put some tip sheets and the meals for Mental Health Awareness Month for people who get Meals on Wheels. We also had a poster contest about what COVID has not taken away, because we wanted youth to feel resilient during this very challenging time. We have Mental Health Rocks, so if you have a chance to go out and look for rocks in the community, we do have some of those that have been put together by Rock Point. There's a library display that has some mental health books, and there is a bingo card that will be in the chat box that you can access and be eligible to get a prize once you get bingo. Mental health tip sheets were sent out to every school district in Portage County. And also, if you stop into Zest and you purchase, I believe it's either a lemonade or an iced tea, 20% of the proceeds will go to the Mental Health Coalition in Portage County. So feel free to access all of these wonderful resources to learn how to help youth and yourself with mental health during COVID. So we're going to get started with some questions. So we'll start with professionals. What are you seeing within your respective fields? So Michelle, do you mind starting?
No, I can definitely start. And working over at the hospital, one of the things that I've been seeing, especially since probably the beginning of the year, and probably overall with dealing with COVID, is I've seen probably a drastic increase in the number of adolescents and teens that have been coming into the hospital that have really been struggling with suicide attempts, overdoses, suicidal ideation, so suicidal thoughts, really struggling as a result of whether this is just strictly because of COVID and the changes that are coming as a result of COVID, really struggling with anxiety as a whole, really feeling depressed, obviously isolating, having a hard time with the changes in their life, with school, with, with having online school, with not being able to, hang out with their friends, with not being able to have the social engagements that they're used to on a normal day-to-day basis. But overall, like I said, really struggling, really having, really resulting in, significant, suicide attempts, mainly being overdoses, and then overall just a lot of heightened anxiety, a lot of worrying. And I think overall, when we look at, how COVID has affected us as a whole as a community, we don't know from one day to the next as far as what we're going to have, what's going to be in place, or once things just start to kind of calm down, or once things are in place, something happens and something changes. And I definitely think that, our teens and our young people are definitely feeling that too. And, things are rapidly changing for them as well. And just kind of looking at how they're trying to function with that and how they're trying to deal with that. And overall, like I said, I think one of the things that I've been kind of seeing and looking at our hospital since the beginning of the year, really taking a look at that and just really seeing pretty high numbers of, like I said, teens, adolescents that are coming through our ER, that are significantly struggling with the suicide attempts, and that are being admitted with, depression and anxiety, that are really, really having a hard time. And overall, really looking at how important it is to make sure that we're getting, the services that they need, and really making sure that we're following up with them and getting them the help and stuff that overall that they need to be connected with.
Yeah, so Aimee Burazin, do you have anything to add to that, being that you are working in the schools and seeing students on a daily basis?
Yeah, I think Michelle explained things very, very well. I think even pre-COVID, we have seen a steady incline and increase in students struggling with anxiety and depression. And I think that COVID really exacerbated those issues in general. And I think that the social isolation piece is a huge part of it. I think when things were really on lockdown, it was more difficult to access resources and access people to be able to assist. One of the interesting school-based things that I think that we've seen though too is a lot of students, I think, struggling with some of that executive functioning pieces of things, that organization, time management, focus and attention. And I think what gets really tricky is a lot of those things, oftentimes we jump to, is there an attention deficit disorder situation happening here, when really that is what anxiety can look like and manifest into. And I think that the one common theme that has really come up is kind of grieving these rites of passage and these milestones, whether it's homecoming or prom, or for our littles and even our parents, graduation and kindergarten graduation and all of those things. I think these little griefs really, really add up. And I think that we definitely see students really struggling with managing how to cope with that, how to come to terms with it.
Absolutely. I think we're all grieving right now the losses of what COVID has done, and we all need support during this challenging time. What about you, Trina? What have you seen in your experience with mental health navigation?
Well, in our program, we've seen a significant increase in parents reaching out to us, asking for resources for their kids, significant increase in them asking for like resources for therapy, and and really not knowing how to navigate, having their kids home initially 24/7. And, when they were self-isolating and having some anxiety and depression, just really wondering, how do we navigate this? So I would say that that's a significant increase that we had in our program.
Great. So we know that there's a lot of people who are in need of services, a lot of people who are struggling across the board. What are your thoughts on ways that we can engage youth to talk about their mental health? And so what should we do? And what are ways that we are kind of doing this wrong perhaps and not engaging the youth? I'm going to open this up to whomever wants to start.
I think I can start. I mean, one of the ways that I have definitely seen, and I mean, I would like to definitely see or hear Autumn's, feedback in regards to this, but, with a lot of the adolescents and teenagers that I see that are admitted to our unit, there's a fair share of them that are having a hard time communicating with their parents and exactly and how they're feeling and expressing, how much anxiety or how they're feeling in regards to their depression. And I think overall, there's a lack of communication skills that are going on. I think that we've kind of gotten into this kind of era of everybody is kind of in this world of, I mentioned technology earlier and having issues with technology. And we've gotten into this world of utilizing technology. And I think with texting and different things like that, I think it's done certain things for us, but I think in a way it's kind of hindered our ability to communicate with each other. And I think that, we no longer do, well, I shouldn't say that, but there's I think a certain lack of people sitting down and actually communicating to each other on how they actually feel and what they're actually thinking. And I think we kind of need to get back to more of that. And I think overall, I think that there's some people, and like I said, I've seen this with some of our adolescents who are admitted that they don't actually know how to describe to their parents how they're feeling. So, trying to be able to figure out a different way to kind of communicate to their parents on how they're feeling. And, I always talk to the parents too in regards to having that two-way street on trying to figure out and be kind of creative and how you communicate. And with the kids too, on, I always tell them that, I'm a parent and, I've raised, two teenagers, and I can tell you from my standpoint that if my kids aren't talking and aren't sharing how they're feeling, I'm going to be worried about them. So it's that two-way street. We have to be able to find a way to communicate on how we're doing, because as a parent, I'm going to be worried anyway. So you have to kind of figure out, how you're going to express to your parents or find a way to share how you're feeling and how you're doing. And whether that's writing things down, or if it's putting up, a feelings chart, or however it may be, but finding some sort of way to check in. I mean, it doesn't mean that you have to go into great detail on, exactly on what's going on and giving them a minute to minute rendition of this is what I did and this is how I was feeling when I did it and da 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 da. But, really kind of that whole idea of checking in and this is how I'm doing and, different things like that. And it can't be, it's not like you can necessarily just send them an emoji and be like, I'm fine. There might need to be a little bit more to it than that. But like I said, just kind of trying to figure out that whole two-way street of communication.
So I too would like to hear from Autumn. I'm curious what you think is something that parents can do to better engage youth, especially around mental health.
So I agree with what Michelle said, and that some like a lot of kids, especially like from what I've noticed at SPASH, is like they're not comfortable like going up to the parents because they're scared like what they're gonna say and stuff. But just like that genuine like your parents asking, "How are you? How was your day?" Like just like checking in on the child, but not being like overbearing to the point where like they don't want to tell you anything. But like knowing that somebody cares about like how you're doing and how you're feeling would really help like some kids, I feel like. And then like at school, there's I guess like there's a stigma against like they don't want to go talk to like the school psychologist or the counselors because they don't want people to know about it. But like even if some of the teachers were reaching out and asking their students like how are you doing? Like how are you handling school? Like are you feeling okay? Just more of that reaching out and seeing how we're doing, and hopefully that would get some people to open up.
Great, thanks. Are there any other comments on this before we move on to the next question?
I have one comment. In speaking with my own two kids, I can say that just asking, how was your day? How are you? And it's good, fine, those types of answers. What I found really helpful is asking, how do you feel? Are you scared about, being back at school with COVID? How are your friendships going? What's happening with the friends you ate lunch with last year? And asking really specific questions, because I feel like then I really learn kind of the root of what's going on, rather than how was your day? Are you doing okay? Because I get good and fine.
Yeah. So what behaviors, Trina, would you say are kind of a telltale sign that something may be amiss, or something that parents can look out for with their own children?
I think really that lack of engagement when you're trying to have a conversation, really shutting down the conversation very abruptly, only answering with a good, fine, that kind of thing. Those are some red flags. I think that parents, need to ask more questions. And like Autumn said, don't be overbearing or in their face about it, but really, try to come at it from different angles. And, how did that make you feel? And really asking, I find asking about friendships is a way in, because, oh, are you still friends with so-and-so? Or who did you eat lunch with today? And then it kind of leads to other things.
Perfect. Thank you for sharing that. And one other thing I want to mention is that I know from working with you, Trina, that you don't just support your own kids, that there are friends of your children or friends of people that that will also reach out just because of your role. What are some ideas of reaching out to perhaps friends of your children to help them with their mental health?
That's a really great question. What I tell my kids is, if you hear these things from your friends, self-harm, cutting, making any type of suicidal ideation, conversations, oh, I'd be better off dead, things like that. I'm like, if you hear those things, what do you do? So we talk about that, just like stranger danger when they're younger, or, don't touch the hot stove. We also talk about, what do you do when someone's struggling? So we talk about, if a friend is struggling, encourage them to talk to their parent. Ask, can you talk with your parent? Are you going to let them know? And if they feel they can't talk to their parent, who's another trusted adult? Is it someone at school, at church, a teacher? Just really encouraging them to speak to a trusted adult. And if they're not willing to do that, and they have, really major concerns, I'm like, tell me, because then we need to intervene somehow and have a welfare check or something done. But I really try to encourage my kids to look for those red flags and talk with people about it and know what the resources are.
Thank you. So the next question is in regards to crisis. So Aimee Pond, I want to ask you this question, since you have a significant role in crisis. Can you please let us know what to do if someone is in crisis, and then also kind of explain the difference between voluntary or involuntary commitments, and what happens if a child is placed on an involuntary commitment?
So basically, if you have a youth that is in crisis or anybody that's in crisis, you always have the option to go to the emergency room, whether that's a SPIRUS or St. Michael's or a local ER, to get medically cleared and to ask for psychiatric inpatient hospitalization. That's always our first step. We want to make sure that people feel empowered to pay their own health care, and that includes their mental health. If the person that's in crisis or somebody that's suicidal is not willing to seek voluntary treatment, that the first step is to call law enforcement because we have an emergency. And parents sometimes are very afraid to call law enforcement because, you know, again, the stigma of having law enforcement at your house, what are neighbors going to think? But we're really looking at the safety of that person that is in crisis at the time. So calling law enforcement, knowing that if they're involved, then they will either call Green Bay Crisis, which is our triage after hours crisis line, or paging out our mobile crisis team through Health and Human Services. And we will assess for the need for hospitalization. And sometimes that's against their will. But again, we follow that person and their family through that emergency detention process. I work very closely with Michelle on a daily basis, sometimes multiple times a day, or different hospitals if they end up at St. Elizabeth's, because there's age requirements for different hospitals. And the mental health navigators and myself, we can work with families, educating them on what specific hospitals can take, which age, and things like that. But the difference really is we want to do the least restrictive, offer those voluntary options first because it's less intrusive and that individual can make their decisions. And if they're in a situation where they just can't make it and they're refusing help, then that's when we step in and take those rights away, at least temporarily, so that they are safe. Did you want me to explain a little bit further?
I guess what we'll do is we'll continue on, and if there is any questions that come up because folks do need more clarification, they can put that in the chat and then we can go from there. All right. Aimee Burazin, can you explain a little bit about the roles of school psychologist, school counselor, or school social worker so that kids are aware and parents are aware of who can support their child in school?
Absolutely. So within each building, at least in the Stevens Point Area Public School District, there is an assigned school psychologist and counselor or social worker. The one thing that we all have in common is that we are all advocates and supports for students, whether it's in regards to learning or mental health related concerns. We're absolutely there for direct student service support. Where things get a little bit more individualized is just kind of the areas of expertise just based on training. Our school counselors tend to be kind of that universal level of support. They oftentimes at the elementary level will provide some classroom level instruction and intervention. And then as we progress into junior high and high school, provide not only that social emotional support, but some of that academic and career planning and some of that related support. Our social workers tend to have an expertise in the area of kind of community resources and kind of that community liaison. Again, whether it's in relation to mental health related needs or, you know, housing, food, shelter, things like that. School psychologists, we tend to have our niche in kind of the special education or accommodation plans. So again, our expertise is kind of in identifying and trying to address some of those learning barriers and things like that. Again, all of us are happy and eager and willing to help support. So please, you know, if you notice that your student there's changes in sleep, changes in mood, maybe they're a little bit more irritable, they're withdrawing, there's a difficulty with school performance, you can reach out to any or all of those student service providers within your child's school.
Great. We do have some questions in the chat.
Yeah, so yep, I have a couple questions that came through. One is discussing not necessarily a youth, but I think that this applies to some of the things that we see in regards to youth as well too. So it's just saying that they have a situation that the daughter has no problem sharing her feelings with the parent. And her daughter is indicating that they're called passive thoughts. She never has a plan, indicating, and some kind of plan for attempted suicide. She is seeing a therapist weekly. In this situation, the individual is away from home, indicating that she's kind of on top of her mental health, but this parent is concerned about just those constant passive thoughts. And I guess for professionals, what kind of advice or thoughts or reactions do you have to that kind of situation?
Is the daughter a college student? Is that why they're away from home, or is it a youth?
It is, I believe, a college student away from home, yes.
Okay, I guess my opinion would be to really set up a safety plan with her daughter. What's normal for the amount of contact the mother or the parent would have with the child? Is it normal for them to check in once a day? And if I don't hear from you, I'm going to be concerned. Are there friends that I can reach out to check on you if you're away from home? Just to kind of get her through that hard time or that crisis feeling that she's having, so that it gives not only the daughter the peace of mind, but also the parent as well, if they can't be in the same vicinity. I guess, the therapy is a great option. Most people do see their therapist once a week or twice a month. It's not necessarily something that going to a hospital is going to fix those suicidal ideation thoughts. If there's a thought that maybe medication is needed, seeing a primary care doctor or a psychiatrist, if medication is needed for depression or anxiety, those are things that not always are fixed with therapy, but are a option to go for the medication route.
Great,
Does
thank you.
anyone else have anything to add to that?
I agree with what Aimee said. We do work with patients on a regular basis that unfortunately do continue to struggle with ongoing passive suicidal thoughts. It's an unfortunate thing. I think the big thing is, like what Aimee talked about, is just coming up with and making sure that they have that safety plan. And just for them, with working with their therapist, the big thing is just making sure that they do not go forward and move into where they're actually go into where they have the suicide attempts. That there are, like I said, unfortunately for some people, where they do continue to have passive suicidal thoughts. So just looking at working with their therapist and working with their ongoing support team and different things as far as what they can do with those suicidal thoughts. What are they doing? What are they working with as far as to deal with those suicidal thoughts? But there are people that unfortunately do struggle on a regular basis with ongoing thoughts.
The one thing that I would add too is, I think, to echo what you said, Michelle, is just working with, again, whatever providers that they're working with, to ensure that they have the accurate diagnosis as well, because oftentimes obsessive compulsive disorder, sometimes that can be the actual obsessions, and intrusive thoughts are thoughts of harming themselves or thoughts of suicide, and that would obviously lead to a potentially different treatment plan than treating it as depression. So just making sure that they're well connected with the right folks to help kind of tease that apart.
Okay, so I have a couple more questions.
A big believer that we need to use the correct terminology when we're talking about suicide. self-harm. When people are talking, are you having thoughts of harming yourself? Individuals that are thinking of suicide are thinking of dying. So using those direct words and questions. So if her daughter is having passive suicidal thoughts, I would still ask those questions. You know, if it gets more than that, have you thought about a way that you would kill yourself? Do you have a specific idea? Would you overdose? Would you get a gun? And asking those direct questions, because then if that person has the means within their home, whether it's pills or a weapon, that the family or friends are intervening to make sure that they don't reach that point when they're unsupervised or without friends or family to intervene.
Thanks, Aimee. Jen, I think you have another question in the chat.
Yep. Do we have peer groups that meet to discuss issues or feelings they might be having? Peer reactions to mental health, such as anxiety and panic attacks, can make a big difference in how a student feels about themselves and that they are not alone. So peer groups.
That was going to be one of my suggestions on one of the previous topics, is when Autumn was talking about things at SPASH. I think it's really important for the guidance counselors and school staff to kind of identify the kids that are doing really well and have a good influence on their peer group, to kind of break down that stigma. Because if they're not struggling with depression or anxiety, it doesn't mean somebody in their friend group isn't. So really being that strong voice among their peers at school, I think, is really important. We do have a peer group at Rock Point for adults within the community, but for school age kids, I think it would come more from the school.
Yeah, what I can tell you is certainly up at SPASH, my school psychologist counterpart and I have run groups in the past. Last year, we were able to run some of those groups with COVID and the changes in the instructional models this year. It's been much more difficult to do that. But we have definitely provided that, and I know certainly at the elementary school level, a lot of the counselors and social workers will run some different lunch bunch groups where they talk about, you know, identifying emotions and self-regulation and all of that. Absolutely, I think that the more that we can reduce the stigma and just make it, just as we would talk about any kind of other health condition, we talk about mental health. I think the more we're going to be able to get people connected with the right resources.
Aimee, I think that that's a good segue into this next question. It seems that when people hear self-harm, they immediately think of cutting. How do we educate our children of the other forms of self-harm, like picking, scratching, biting, and even eating disorders, and how much of an indicator are these lesser self-harms of a bigger issue?
Yeah, I never want to underestimate the self-harm. You know, you're right. I think a lot of people think it's mainly cutting, but there are also those issues that you mentioned. I do have a high school friend who lost her son to suicide because he was a cutter and it got out of hand. And so that was kind of a wake-up call for me personally and professionally, that we have to take those self-harm behaviors seriously. And I think it comes down to just educating our kids and our students about appropriate coping skills and just that there are other ways.
And I think you're right. I think that, you know, one of the things that we do talk about, I know at least from my standpoint, is when we have, whether it be teenagers or adults on our unit, we do see other areas of self-harm, as far as that it's not just cutting. We also see burning, we see picking, we see alcohol and drug use can be a form of self-harm. So there's definitely, you know, other forms of self-harm other than just cutting. I think that it is one of the big things. I think when most people think of self-harm, they think of people cutting. But obviously there are other forms of self-harm, whether it be, you know, somebody who is starving themselves or, whatever it may be. But I think it's just, a normal reaction that most people have when they think of self-harm, they think of cutting. But I think that it's something that is discussed in some areas because, like I said, it is something that, at least from our standpoint, as far as working inpatient, it is something that we do see other forms of self-harm. We do see like biting and like I said, picking and different things like that as well.
So another question just popped up. How do we reduce the stigma? So I don't know if someone from the coalition wants to talk about maybe some of the efforts that we are doing along with these conversations.
I can talk a little bit about that. We're doing a lot of community education. This event tonight is one, to get information out there. We have done coping tip sheets that we've sent to all of the school districts in Portage County to identify ways that children, adolescents might be struggling and having some behaviors that indicate that they're stressed, and different healthy ways of coping. We've done public service announcements in the past. We've done magnets that talk about your feelings, and if you're feeling this way, try this healthy coping. So we're really looking at innovative ways to get information out to the community. We have a Walk for Hope that is every September that is kind of giving families who may have had a suicide in their family, or a family friend, or just someone that they know, a way to honor them and also educate people about suicide. So we're always looking for ways to really reduce that stigma and get people talking about it, just talking about their mental health and role modeling those conversations for people to make it more normalized. Michelle, do you have anything to add to that?
Yeah, I mean, along with all the different things that Trina said, one of the big things that I always tell people is, whenever I'm out doing trainings or just out in general, is just getting people talking and just making people aware of just little things that you say, little things that you do, making people aware of just the overall reactions, just the things that we're aware of. One of the big things this month that we're doing for May Mental Health Month is having books and different things in the library that have to do with mental health, and bookmarks and different things like that. And one of the things that I found interesting in working with one of the libraries is they had said to me, well, should we put the book display maybe back to the side? Because maybe people wouldn't necessarily want to be looking at the books. So maybe it would be a little bit easier if we had the books maybe to the side. So once again, it's one of those things of looking at, well, okay, maybe, but then it's kind of like, no, let's have it right smack dab in the middle of the library, because once again, it's mental health. Let's have it out there. Let's talk about it. Let's the elephant in the middle of the room, and let's have the elephant there. But it's kind of this idea of, let's talk about it, and just overall what people say. It's where I work, it's interesting on how many people, when I answer the phone, they'll say, is this the psych ward, or is this different things like that, and I'll correct people and I'll say, this is the mental health unit, or this is the behavioral health unit. And just that's all part of too reducing the stigma, and just correcting people, and just kind of saying to them, no, we prefer that you call it the mental health unit, or we prefer that you call it the behavioral health unit. Or even when I go out and I do suicide prevention training and I talk to people about, we say a person died by suicide, or we say a person, decided to take their life, and just changing the wording that people utilize. And just when you're out and about, and just little things that people say, just and looking at things, and just, that's all part of it. And, I encourage our patients, when we have patients on the unit and they've been hospitalized, I'll hear them many times that they'll be calling somebody and they'll say, "Oh yeah, I'm at the spa for a couple of days," or I'm away for a couple of days. And I'll be like, don't do that. This is part of the breaking the stigma and really telling people that, you're getting help and it's okay to get help. That is all part of the reducing the stigma and telling people that it is okay that you're getting help for your mental health. And, I'm a big proponent of that. And, once again, it's kind of, if anybody's with me that knows me and somebody says something wrong, they're all kind of, they turn and they look at me real quick because they know I'm going to correct the person. So once again, that's all just kind of part of it, I think.
I think that it's important that if a parent or a sibling is seeing a counselor or a therapist, that they have that conversation as a family saying, I see a therapist and it's okay. And if you ever want to see a therapist, I will support you in that. And just kind of breaking it down at family dinners, just normalize the conversation. I know I've had the conversation with my son who's in middle school, and he already has told his friends, like, if you can't trust your mom, you can talk to my mom. And so it's just a normal part of our conversation in our house.
I think another way of reducing the stigma too, in that same sense, is as a parent and as a professional in mental health, is talking with our kids about, I struggle today. I might feel, especially during COVID, everyone had anxieties and fears about it, but letting our kids know that it's okay to talk about those things, and not to try to hide it or whatever, but to role modeling that as a parent and how we have self-care and how we stay mentally healthy. It's really important to have those conversations as well.
So I want to take this time because there was a question about accessing peer groups or how do we get them started. I'm going to put in the chat again the Peace of Mind website, which is a new website that United Way has recently launched. And on there it has a plethora of information and resources, and it also has a community calendar on there, and on there they have local community peer groups that NAMI runs specifically. I know that those are on there right now, so that's going to be like a one-stop shop where you can access a whole lot of information regarding mental health here in Portage County. So I will drop that in the chat again. I think that when we're talking about reducing the stigma too, one of the things that in the school district that we do specifically, and Aimee can jump in on this as well too, is that there's a lot of social emotional learning programming that we infuse, especially into the elementary schools, into our classrooms, that talk about identification of emotions and how to help self-regulate. And teachers will often infuse those practices into their daily schedules, doing mindful minutes or yoga, and that just depends on the school that you're in and the teacher that your student has, but those things are being taught. Do we have room for improvement to maybe reduce stigma and talk about it a little bit more directly? I think so, but I know that the schools are really pushing, getting teachers access to these resources as well too, and helping them to have the conversations with families and students, so that those conversations can be had more easily, and within a comfortable level as well too. So so at the elementary level, they do that within the classrooms, and then at the high school level, during advisory lessons is that time that some of those direct instruction pieces are taking place, and those are changing and evolving as we go through COVID, as we head back into what we hope to be somewhat of a semblance of a normal year next year. So those things are being discussed a little bit more openly among students and among teachers and among school staff as we wrap up this year and move into next year too.
I also think that it's important to bring up that we're not just talking about kids that might be suicidal or, are able to express, self-harm behaviors that they might have been engaging in. I think it's really important to talk about the elementary school kids as well, and how the county does have our special needs programming for kids that are struggling with mental health. And that just takes the parent calling the county and talking to our special needs section about services that would be available for their children. But that has to be a parent referral. It can't come from the school. So having the parents be mindful of that.
I think the one thing that I was just going to add to is I think if there has been any silver lining to the pandemic, I think there's been kind of a spotlight on mental health and the need to expand the conversation, expand resources, and approach things from a systemic level. Because I think everyone has had this collective grieving experience of what we've lost and what we've missed out on. There's a collective anxiety. I like to think that there's a better understanding of what that truly means when someone is coming to us and sharing that they're feeling anxious or they're feeling depressed or things like that. And so I think that there has been more traffic in the counseling offices and the psych offices. I think that parents are identifying, better when kids are struggling and reaching out. But I do have to say, I think that, again, I think that that's maybe been the blessing in disguise is I think that COVID has opened up the door to some bigger conversations and hoping to lessen that stigma.
Yeah, I would definitely agree with that. And all of us having, a role in the lives of other people and their mental health and well-being, I think we know the level of importance in making sure that we are getting that consumer voice and we're hearing from people who are accessing services. So I want to switch gears a little bit here and put Autumn on the spot. Sorry, Autumn. I want to know how you're dealing with typical high school stressors and how COVID has compounded those stressors.
So typical high school stressors would be like staying on top of my classes, making sure I understand the material, and like doing well on tests. COVID has impacted those a lot. I know me and along with like a lot of my other classmates, we lost, especially as a senior this year, we lost a lot of our motivation from being online to 4 days a week, or all online to 2 days a week. That was kind of a big change. But then going from 2 days a week to 4 days a week, that was like the weeks just felt like really long at first because we haven't been doing it for a really long time. And like we just have to make sure we stay on top of it. And it's hard looking in two different places and knowing you might hear something different in class versus online. What helps me is I email my teachers whenever I need help, whenever I have a question. I'm also an organizer, so I keep a planner with a list of things. I will ask like my mom for help with things if I'm stuck or need to help her, or if I need her help to de-stress from school and stuff. But the biggest thing I say would be reaching out to your teachers, whether it's over email or in person, and just asking them for help and support with whatever you need.
So Autumn, were you comfortable reaching out for support on your own? Did you do that on your own? And how did you connect with the student services staff?
I was pretty comfortable reaching out on my own. I have worked with Aimee to help get like accommodations with some things that I needed help with, and then a lot of the other teachers I reached out, I was like, I'm really struggling, I got a lot going on. I'm a bad test taker, bad at school, like, can you help me? And they'd always give me a good plan and help me get better grade and stuff. So you just got to make that first jump and then it'll be good.
Yeah, that's so true. I know we probably all can say that we've seen that with people who, struggle to reach out for help. So thanks for sharing that. I definitely appreciate that.
Yeah, of course.
One more question here. We're running out of time, so I want to be cognizant of that as we're asking questions. We have some questions that are relatively similar, but they're around the idea of how do we make resources more available for people in our community, more, how do we make them more affordable? And what are we doing about the shortage of folks to help people struggling with mental health conditions? Does anyone want to comment on that?
Well, I can say that I know our local United Way has an initiative that they're looking at how to bring more providers to our community. And I believe that through Ascension and Aspirus, you know, that some new providers have been added for like psychiatry and therapy. As far as finding out what's available, both Lisa, the facilitator, and I work in mental health navigation, and it's a program that anyone in Portage County can reach out and let us know kind of what their stressors are, what they're struggling with, and we will help you find what resources are available to you. In regards to affordability, we look at what insurance coverage people have and try to find providers in those networks. If they don't have insurance, then we'll look at assisting them in applying for like Badger Care to see if they're eligible for that type of insurance coverage. If they're not, and they're just looking for like a sliding scale fee, we are aware of a few resources in central Wisconsin that we can refer people to.
I would also encourage individuals to look into their benefits to their employer. If they have any kind of employee assistance program, you can use it for yourself, but you can also use it for your children. And it varies, you know, it's anywhere from 6, maybe 12 visits with a therapist. And that might be all you need to get through that initial crisis or get connected with different resources. Also, a lot of primary care doctors or nurse practitioners are comfortable prescribing medications for anxiety or depression. It's when we get into more of the bipolar, schizophrenia, that need psychotropic medications that the primary care doctors or the nurse practitioners aren't willing to prescribe. But developing that relationship with your primary care doctor or your child's primary care doctor could be a good initial resource as well.
We do have a question related to helping a teen who is struggling with social anxiety and self-confidence, help being better, stronger, and more confident. And then we also have a question about working with students who have anxiety or panic attacks. So what are some things that parents and staff are doing, or parents can do and staff are doing, that are working with students that is helpful in the area of anxiety, because that tends to be one of the most talked about issues that we're seeing right now. So students and anxiety, what are schools doing?
Yeah, I do think that we've done, we've made a concerted effort, I think, to provide some professional development to our staff in terms of what to look for. Because as I said before, anxiety can be kind of sneaky. It can kind of look like irritability or defiance, or it can look like, you know, ADHD and things like that. And so we've definitely done some professional development for staff to start to be able to better identify that. What I do when I'm working with students is we really try to backtrack and kind of come up with a plan in terms of, you know, what are some of those initial triggers, so that we're not waiting until it's a full-blown panic attack for you to be able to get support. Where are your backup places so that you're not having to go through that by yourself in the bathroom, for example. You know, and talking through if you need to talk, if you just need a space, if you need an alternate place to work. That's what all of our student services staff is really there to help with, is figuring out what are those triggers, what is the plan when things get kind of out of hand, and helping communicate that plan then to the teachers and to the parents too. The other thing that we really try to do then is work with any outside providers on any strategies, or helping the family get connected with outside providers. And one of the things that we often recommend, we actually have some outside counseling providers that come into a lot of our schools. And that helps us just alleviate kind of some of the stress of setting up the appointments and transportation and things like that. So, you know, definitely it's a team approach with the outside providers, with the school nurse, with the families to kind of figure out, you know, how best to address some of those triggers that might be happening.
One of the big things I know as far as like on the unit initially that we work with teenagers as well as adults, as far as anxiety, is coming up with skills, obviously, and working with the anxiety and coping with the anxiety. And one of the big things I know that I like to utilize a lot is just overall mindfulness and utilizing their senses. And I think a lot of times for teens as well as adults, it's really helpful just in utilizing kind of the senses, like the sight, the hearing, the taste, the touch, and different things like that. Because for a lot of your teens and stuff like that, it's something that they can utilize in going back to school, because it's something that they can do wherever they want. And a lot of times I kind of describe it to them as, you know, you're basically trying to get yourself out of autopilot, and not just kind of let your mind kind of go off and travel and kind of worry about lots of different things and stuff like that. And it can be as simple as, you know, taking, you know, like a piece of sour candy and popping it in your mouth and just kind of bringing you back to the present and different things like that. But obviously just kind of some quick tools, and then just, you know, kind of encouraging them obviously to follow up with outpatient therapy and, you know, continuing to work on, you know, with their anxiety and depression or whatever else it may be.
I would also say the other, you know, kind of talking point, you know, when someone's struggling with anxiety, they're seeing everything as kind of a threat or as a danger. And so a lot of what we talk about then is, what is the evidence that that is going to happen? What is the actual situation? You know, and when you start to kind of talk about what is the evidence, what is the data to kind of support what it is that you're kind of stressing out about, a lot of times that can kind of help put everything kind of back into perspective too.
So it's past 7 o'clock, so we're going to wrap this up. I think that, Jen, are you going to share the other resources that are listed for CAP services and the Peace of Mind website in the chat?
I will follow up with an email with all the resources to those that attended. Yep.
Oh, perfect. All right, great. And then the next conversation is going to be next Tuesday, same time, 6 o'clock to 7 o'clock. And there's still time to register. And remind me, Jen, what's that one going to be on?
That one is going to be on mental health and substance use. So UW Extension is going to be doing a walkthrough of a mock teen bedroom to show participants various products in relation to tobacco or other substances, and just to help identify some of those products and talk about some of the local trends that we're seeing. We'll have local law enforcement participating as well too, so they can answer questions in regards to what we're seeing in Portage County.
Wonderful. Well, thank you to all of our panelists for spending this evening talking about mental health, and thank you for all who attended. We appreciate you taking the time tonight. And again, just want you to all know that we have some wonderful resources and people in our community that are working very hard for mental health and improving stigma and reducing suicide. So please know that we are here to support you and your families if you need anything. Thank you.
Lisa, thanks everybody.
Thank you.